go. And we will introduce Tad Haynes. He is the president of Unicare Health Plan for West Virginia. Thank you, Tad.
Hey, thank you, Kelly, and good morning, everybody. On behalf of Unicare Health Plan of West Virginia, I'd like to welcome you to the Health and Hunger Summit series, the first summit of its kind in our state to build bridges between the healthcare delivery system and community food resources. We know that health and hunger are profoundly connected, and for this reason, so should the systems that provide care. We'd like to express our gratitude to the panelists and attendees for joining us today for Session 1, the State of Health and Hunger in West Virginia. The goal of today's session is to take an open, comprehensive look at the state of food insecurity and its effect on West Virginians from both the healthcare and social support systems. This is the first of 4 sessions that will take a deeper dive into the effect that hunger has on our health, the challenges to addressing food insecurity in the healthcare setting, the challenges to connecting community resources to the healthcare system, and finally, potential policy recommendations on both the local and state levels that can make it easier to bridge and better connect these systems. At the end of these sessions, we'll share an event brief that highlights the dialogue shared here and online over the next several weeks. We know hunger has been an unfortunate challenge in our state for many generations, and sadly, during the global pandemic, things have only gotten worse. This is a necessary and timely conversation. Your input and insight are valuable in creating and enriching this dialogue, so your active participation is greatly appreciated. Unicare Health Plan is a Medicaid managed care organization that has been serving West Virginians since 2003 and is part of the Anthem family. Through our work with vulnerable populations throughout the country, we know that there is a strong linkage between health and access to social and economic opportunities. The conditions in which we lived oftentimes explains, in part, why some of us are healthier than others. Living in poverty, living in a food desert, or living in a situation where there is a question of where your next meal will come from are all factors that can cause poor health outcomes that have to be addressed by the healthcare system. For these reasons, we are proud to sponsor this summit and partner with the Think Kids organization led by Kelly Caseman. Kelly, thank you for your leadership and commitment to West Virginia, and I'll turn it back to you.
Thank you so much, Tad. We appreciate you being here and for your sponsorship. So with that, we're going to go on to, on the phone is Dr. Ayne Amjad. She is the Commissioner and State Health Officer with the Bureau for Public Health in the West Virginia Department of Health and Human Resources. She has been a private practicing physician specializing in internal medicine and preventive health care and founder of Be Better, a nonprofit organization against opioid addiction. She is the Assistant Program Director of Encompass Health in Princeton, West Virginia, and the Medical Director of PCH Home Health in her hometown of Beckley. Dr. Amjad is also a member of the Human Rights Commission in Beckley, serves as the Secretary of the West Virginia Board of Medicine, and is a Fellow of the Federation of State Medical Boards. Thank you for joining us today, Dr. Amjad.
Thank you, Kelly. Good morning, everyone. I do want to tell everyone ahead of time that I do appreciate being part of this panel. Kelly asked me several weeks ago, and so I do want to tell everyone thank you for that. But prior to my role as a state health officer, I was part of private practice in Beckley, West Virginia, and all the things that Kelly mentioned. So I do have a lot of different roles prior to this current one, which I will give a little bit of insight into that experience as well. So going forward, I did want to, I guess, break up my conversation. I think I have about 10 or 15 minutes for my talk this morning. So I'll start with about 3 things that I wanted to highlight as far as hunger and food insecurities in West Virginia. So going over that, I'll start with 3 things I wanted to mention was just overall a state overview about poverty in West Virginia, and then a general medical overview about the things that we are currently doing and would like to do moving forward. And then with my previous role as a private physician, I practiced about 10 years in private practice. So I have a lot of personal experience of what patients and they've had with food insecurities in West Virginia. So I'd like to talk about that because I do think it highlights some things on that personal level. But going with that, everyone knows about the food insecurities that we have in West Virginia. West Virginia is is a very poor state, and we can go into that. Our poverty rate climbed from about 17.9% to about 19% within the last year. A lot of that goes into the fact that we have lost a lot of jobs. Our main source of jobs in West Virginia was mining and logging. About 22,000 people in West Virginia are employed by the mining and logging industry, which we know have lost a lot of jobs in West Virginia. The next higher market jobs are in education. About 130,000 people in West Virginia are employed through our educational system. And then the next highest job occupation in West Virginia are through healthcare and government. So, you know, without those jobs, then of course there is a lot of unemployment. You know, besides this year, with COVID being a main factor of it being a very bad year, people have lost a lot of jobs. So our poverty rate has climbed. West Virginia, along with the other states of Mississippi, New Mexico, Louisiana, Kentucky, West Virginia is always in that high poverty rate. So food insecurity goes along with that. The opioid crisis in West Virginia, we've always been in that top tier of having that. Along with that, we suffer from many other resulting effects. So that, you know, overall the state, we've always been the top for being a poor state, not just with financial issues, but also with healthcare. You talk about the tobacco problems, you talk about the opioid crisis, you talk about anything with healthcare and then relates down to food. We've been in that top tier, and we continue to suffer from that. Education and then nutrition, you know, when we've heard that over the last couple of months when it comes back to school reentry, our school children have relied on the school system for food, and that is a big part of where children get their food sources. I did ask, you know, the West Virginia Department of Education to provide me with some information for the foods programs. They have provided, you know, over 17 million meals from March through July, and they continue to do so. They continue to provide backpack lunches, and I know a lot of the next speakers over the next day or so are going to provide even more detailed information. I went to go visit one of the schools within the last week, and I saw how they were doing some of this, and it really opened my eyes to see it firsthand. The children in the school system themselves, you know, they're eating at their desks, and the ladies who are preparing the meals, you know, keep in mind they had only the same ladies who are preparing the meals were making the meals in these carts to deliver them to the children at their desks. In addition to that, they're preparing the meals in boxes for parents to take home to the children who are learning virtual. So then the principal was telling me that they were doing this also throughout the summer. So they were working really hard to make sure children had the meals at home as well as in the classroom. And they told me they were doing this throughout the summer, and this is occurring, you know, throughout. So it really opened my eyes, because you read about it and you see numbers, but until you see it, you see how hard people are working to make sure children have food. And then this was around, I think, 11 o'clock, and the boxes were still there. And these were boxes from breakfast time. And I asked what happens with those boxes from breakfast if they were not picked up. And the principal told me that they go deliver these boxes to churches and other food banks so they can be delivered so that they're not wasted. But, you know, that's what happens with the food at the school level system. To go on forward with that, you know, the SNAP program, which is a Supplemental Nutrition Assistance Program, formerly referred to as food stamps, as most people know that regular term. Those numbers and the amount that is given to families is based on, you know, the amount a family earns per year. And that number has decreased, and I can talk about that more on a personal level from what patients have told me, but average SNAP benefits can range from $200 to $300 per month based on what your family earns, and also based on, you know, how many people are in your families. But when you look at that amount of money that people are given per month, it's not much. And if most people know, when you go to the grocery store, you can see how much things cost. And if you're trying to buy nutritious food, it's very, very difficult. And I'll give some personal accounts for that when I've tried to speak with patients about buying nutritious food. going on to my next medical overview, there are ways to look at, a lot of people ask, how do you identify someone with food insecurity? What does that mean? What's the definition? And I know there's a lot more speakers who are going to address that, but when you look at food insecurity, it's not just that the person can't get enough food, but it can also mean a lack of nutritious food. Nutritious food, to me, obviously is just, not just fruits and vegetables, but also protein. And, we learned about the food pyramid in school, but that's also been changed in some form or fashion. And there's different ways people look at that as well. But it's also nutritious food and what the child or adult needs, and even our seniors need now in order to be considered healthy. And identifying we're talking, a lot more of children these days, but adults as well. And we look at our senior groups as well. But physical appearance, we can think of when you think of food insecurity, but it's not always a child or an adult who is skinny in appearance. People who are bloated, or we can speak of children now, just for the sake of the discussion. A child who is also maybe obese looking or swollen in appearance could still be food insecure because they are not necessarily getting all the nutritious food that they should be getting. They might have cracked lips, they could have swollen puffy eyes, they can have dark circles under their eyes. That can be a sign of malnutrition or vitamin deficiency. Another sign could be that they're very anxious. They are oftentimes getting to school very early, getting to the line early, asking for seconds, eating very quickly because they are afraid the food might not be there. Another thing might be that you can ask the child what their favorite food is. They might not have one. A lot of times you can ask the child if what they had for dinner. They might not, some children don't remember because they just don't remember, but they might not say what they had for dinner because perhaps they did not have a dinner that night. And a lot of times our tendency is to blame the parent or the caregiver, but most of the times they might not be able to have the means to provide the food. So that leads me to my next topic, in a sense, is that we have to take the stigma away from food insecurity, that you will be surprised of how many people are not able to provide even though they want to. And I'll get into that in a second, but the stigma of food insecurity needs to be taken away, and it could be in more of an open discussion among close friends or families or church communities, where even myself, and when I get into a little bit about my personal experience as a medical doctor, I was surprised of what patients were food insecure that I was not aware of until we had further discussions about food insecurity, that you would be surprised of the people who need help with food. It is not your typical person anymore that you would think that needs help. A lot of times when people have lost jobs, and you might know that they have lost their job, and I call it the bread question. They cannot afford a loaf of bread, and you might say, well, a loaf of bread is $1.25 or whatnot. But it comes to that point where something like that has become such a need that they are actually going to food banks to get that. But moving forward, that's the stigma around food insecurity is great, that we would be surprised. So that's one thing. Meal planning can be something that can be discussed, proper nutrition, and also how to triage food in such a way to get the most nutritious food to families. That is important. A lot of times families are very busy, obviously, that they do go through drive-thrus, and it's also sometimes cheaper to pick up I'll say a Happy Meal, because it is cheaper than going and buying the ingredients to fix the food. I do tell families a lot of times, if you have a favorite fast food place, try to look through their menu and pick the ones that have the least salt, the least calories, and buy that. If that is the option you have, then do that. That is your best choice. So there are options, there are ways to discuss things. We all know that we do not have a lot of farmers market type places in our areas, depending on what county you live in. But we do try to strive and have those options in West Virginia. But I do encourage people to take away the stigma of food insecurities, to speak to your neighbors, your communities, and you would be surprised at how many people cannot afford that loaf of bread. So I'll quickly move on to my personal experience as a medical doctor. like I mentioned, I was surprised myself of the people I had talked to who could not afford bread. I knew they had lost their jobs or they had some issues in their personal lives, but they were going to a food bank and getting some food that I didn't realize that they were that quote unquote down and out because they had not brought it up. And the reason it comes to this was either their blood sugars or their blood pressure was out of control. So, I would go into my usual doctor mode speech of controlling your, what are you eating? What are you doing? Are you doing this and that? And we'd go into this nutrition, question and discussion of maybe you should buy this, maybe you should buy that. And they would tell me, Dr. Amjad, I would love to buy the stuff for a salad. I would love to buy this, but it's very expensive and it would be gone in 2 days. And I end up buying a bag of potatoes because I could make this. I would end up buying a bag of pasta because it's cheaper. And so I got to realize that, yes, they're right. They cannot buy the things that I would want them to buy because of the cost and the bulk of what things cost. And then we got into discussion of how maybe a bag of frozen vegetables or a can of this and a thing, but fresh food is more expensive. Sometimes you would have to buy frozen vegetables or canned things, but yes, carbohydrates are cheaper to buy and you can save them longer. And that is when one patient was talking about her SNAP benefits and how it had decreased almost $180 that month. And how she stretched it for that whole month. And I realized what she was trying to live off of. And then on top of that, I believe some family moved in with children. So, it opened my eyes at that time to a little bit more, and I had learned myself a little bit more about it. But that's why I would encourage people to realize that you never know who is struggling at that time, and to take away that stigma. And if you can help someone in your community, maybe someone in your community has children. I know there was someone who worked in my office said that her son, his friends would come over and eat at her house, and she said they were always so hungry, and she herself wasn't didn't have a lot herself, but she said she would feed them whatever she had. So if there's a way, I guess, to share what you have, if you're able to, think that as well, because you'd be surprised of what people are going through. But we waste a lot of food, I know, and if that is something we can reconsider to think that as well. But those are just the basic things I think of as food insecurity, just a general overview that our state has lost a lot of jobs, which take into account, which, that's a bigger discussion as well, that we need to take away the stigma with food insecurity, to keep it an open conversation is not something to be ashamed of, and that if there's a way to think of nutritious food, and of course, most people think of some nutritious food as not tasting very good, but there are ways to make it taste better, of course, for children to get it on their palates better, and to just talk about it more, I guess, with people so they don't feel ashamed about it, because there's no shame in food insecurity, and keep the conversation going. So I'm very happy to be on this panel and be happy to be involved as much as I can. And so I really thank everyone, and I was very pleased to meet Kelly. I met her online, and I think she does a wonderful job with everything, and be open to any questions or any future questions that you guys are involved with. Thank you.
Thank you so much, Dr. Amjad. We're glad that you joined us today. I'm going to move next to Cynthia Kirkhart. She is the Chief Executive Officer with Facing Hunger Food Bank, located in Huntington. She has been with Facing Hunger Food Bank for 6 years, and prior to that, spent her career in helping professions that aligned with helping children and families through the trauma of abuse, domestic violence, and the many impacts of mental illness and poverty. She received her Bachelor of Arts from Marshall University with majors in psychology and English. She received her Master's in Psychology from Georgia State University and her Master's in Business Administration from Ohio University. So welcome, Cyndi.
Good morning, everyone, and what a prestigious group that I'm on this panel with. It's fantastic to see virtually, everyone, and what great information from Dr. Amjad. I'm going to talk a lot about the food bank and our approach to health and hunger with children, families, and special attention to chronic disease today. Facing Hunger Food Banks serve 17 counties in West Virginia, Ohio, and Kentucky through several programs. In total in West Virginia, on good days, we're serving about 111,430 individuals, which is 42% of the total of food insecure. We're blessed to have a wonderful partnership with Mountaineer Food Bank. So in 5 of our counties, we share coverage with us providing the USDA federal commodity programs, with Mountaineer providing additional food resources. Additionally, we have partnered for the past couple of years to have the Hunger Free West Virginia initiatives at the Capitol. Just want to do a quick overview of our programming. Dr. Amjad referenced the poverty rates in West Virginia, and in total in West Virginia, we certainly have our challenges, but nationally, in the United States in 2016, 12.7% of Americans lived in poverty, and that represented 40.6 million people. Now that was pre-COVID, and since, we have engaged in our practices with COVID, everything is a new normal. At that time, 13.2 million children, or 18% of all children, were food insecure and lived in poverty. There's a considerable amount of research that demonstrates that people living in near poverty have disproportionately worse health outcomes and less access to health care than those who do not. Chad will speak very specifically to some of that, but I did want to ground some of our programming and the rest of my time with you as to why we're doing what we do. Backpack programming, we started in 2012 with 1,250 children. We're over 4,000, and due to some really gracious funding from the Palatine Foundation, in this COVID environment in the past school year, we touched over 11,000 additional lives in terms of backpack programming. We have been able to cover all 17 schools, as an example, in Logan County, to add 3 school pantries in Mason, and to add schools in all of our remaining West Virginia counties. Backpack programming historically for us had been very specific to donated product, but with our funding partners, we're able to provide consistent and healthier food than we have previously. Thanks, Kelly. Senior services. We approached Mountaineer in partnership to get the Senior CSFP program, which is the Commodity Supplemental Food Program. We were the 3rd from the last state to apply. So I think that sometimes being almost next to last helps. So right away, we were able to get a caseload of 5,000 seniors that was divided between the 2 food banks. The hard number is that we have 30,000 seniors in West Virginia that qualify for the program, and that number continues to grow because, as we know, we have an aging population in our state. Due to the success of the implementation of that program, we have requested and received 2 additional caseload expansions to total over 5,700. And we're looking to again ask for additional caseload expansion very shortly. We also provide the Community Supported Agriculture Program, which is a week's worth of fresh fruit and vegetables to senior citizens living in high-rise buildings in Cabell County. This is in support of gracious funding from the Cabell County Commission, who helped us in the identification of feeding seniors locally. What we found in all of our programming is that 1 out of 3 chronically ill adults is able to afford medicine, food, or both. And one study found that a 4.5-year gap in life expectancy at birth between counties with the highest versus lowest socioeconomic ranking. So right away, we are trying to fight with challenges. Out of some of these, anecdotal reports as well as our own research, we developed additional programs. The medically indicated food box program that allows us partnerships with healthcare providers, Fresenius, Cabell Huntington Hospital, Valley Health Systems, Ebenezer, and I'm proud to report that we have a developing relationship with Marshall Internal Medicine that allows us to provide medically tailored food boxes for patients with end-stage renal disease and chronic disease, such as diabetes, hypertension, which are both precursors to dialysis. We have always provided mobile distributions, which are mobile food pantries to areas especially limited to food access, what we refer to as food deserts. But with the pandemic, we've had to kind of change those things too, reducing touches, making things much more mobile, pre-packaging as much as possible. And in that process, we have designated a staff person that will serve as a mobile distribution coordinator and coordinate with the mobile food pantries, as well as to coordinate emergency home deliveries to ensure the right food gets to the right people at the right time. We were also recently awarded the Order Ahead pilot project in our partnership with Feeding America, which will begin in January. That's in partnership with Marshall, and they have a food pantry there. And we'll facilitate a choice menu emergency food box to university students and those residing in the immediate community. Go ahead, Kelly. So overall, this is an outline of the counties that we serve, the percentages of food insecure for both adults and children, and then the totals. Like I said, on good days in West Virginia, prior to the pandemic, we were at 111,430. We had increases at one point with a high of 50%, which got us at 167,145 souls. Now we're at about a 20% above usual demand, which is putting us at about 133,700. These are folks that have newly entered the system who were not known to us previously. And we have certainly, over the course of this time, navigated them through this system, but also had the safety net services reveal some of the breakdowns. Almost immediately, we were called upon to touch senior lives. So I want to kind of talk about that with our hunger and health initiatives. We previously did have to rely more heavily on donated food products, and TFAP was much more limited in type and volume. Funding limitations, as I referenced previously, created real challenges for us to offer healthier foods and certainly consistency. We also recognize that many of the people that we serve suffer from obesity, hypertension, and were either pre-diabetic or diabetic. And there were the challenges, as Dr. Amjad referenced, to folks being able to afford healthier food. We went into backpack program particularly concerned because we were relying pretty heavily on processed food. And at the end of the day, I had stories of children that were taking ketchup packets home to their siblings, opening up the packets, putting warm water in, and considering that tomato soup. So while we can always do more and better, obviously, we want to avoid those kinds of circumstances of children resulting in hard choices for hunger. And through those gathering of statistics and engaging with those we serve, we really went after funding to emphasize that better food offerings and to assist those we serve with better health and, by extension, a better life. So, the medically indicated food box program was our initial foray into a hunger and health initiative. We were so blessed to partner with the Benedum Foundation and serve over 825 people, protein and diet compliant foods to support their plans and their response to treatment interventions. and more importantly, to help them self-manage their chronic disease. We weren't tracking health indicators at that time, but as the program was going on, we got some real notable increases in albumin levels and response to treatments, their sugar levels, and we started to also notice a decrease on dependency and emergency care visits. Once that funding ended, though, as is the usual with grant funding, we were not able to continue the program for a little bit, and then started to receive anecdotal reports of the health achievements then regressing, which is a position that's not anything that we wanted to sustain. Many of those families were identified to having had grandchildren living with them, and the children were benefiting from the food and education we were providing. We did cookbooks, we had recipes, we had opportunities to take products that kids weren't familiar with and give them cooking, exercises so that they would learn how to eat healthier. And then we were able to pursue and achieve very gracious funding from the Palatine Foundation to support the program for 2 years and expand its reach. So that was a true blessing for us. In the second year with that program, I will add that the program is expanding, and I have to give a shout out to Janice Stoner and Janelle Ray, who are absolutely committed to the success of their funding initiatives. So our backpack programming, like I said, we've been very aggressive to pursue grant and donor-based funding for backpacks, and we've been able to increase the nutritional value of the foods with, in addition to regular sources of protein, clean proteins and products to address allergies and health indicators that will help families to address those pre-diabetic situations and obesity. And certainly allergies are a concern at this point. Benefits of that are that the kids are receiving foods that are lower in sugar, fat, and carbohydrates, lower sodium, and the protein available at the meals keep them feeling fuller longer. What are the challenges? Transportation. The kids are on the bus quite a while, so there remain issues with the viability of providing fresh fruits, vegetables, fluid milk, and other perishable products that would be even healthier than what we're providing. And, just the preparation of fresh foods and ensuring that families have adequate refrigeration and freezer capacity. We are dealing with families who cook with a microwave and may not have a stove. So we have to consider all those things as we're moving forward. We have additional child nutrition initiatives. Our summer feeding program and child feeding programs have expanded to, again, include more fresh product, and at a minimum, those frozen foods that can be easily thawed to provide healthier sandwiches and choices, and then decreasing that reliance that we have had on shelf-stable foods. Again, as many people our children are being raised by guardians and grandparents, great-grandparents, we work with the families to ensure that everyone in the home has adequate and appropriate food supplies to meet those nutritional needs. We tracked at the start of the pandemic some of our distribution initiatives. So if, Kelly, we could look at the pandemic interventions. Oh, okay, yeah, sorry, skipped a slide. The pandemic has created opportunities for us to think outside the box. Our pantries, a lot of those volunteers are in their 70s and the most vulnerable population. So we had pantries to close. So we had to really get focused on how can we get food to communities safely. TFAP and our other federal food programs have increased the variety and volume of fresh and frozen foods. That has been a challenge for us, and certainly Mountaineer could probably speak to that as well. So we have really worked very hard to make sure that our pantries have coolers and freezers, that we have enough capacity. And as I referenced before, we have really identified some breakdowns in safety net services and look to create more services such as packaging grab-and-go bags for seniors and children. really emphasizing the allocation of resources for direct mobile deliveries of emergency food. I've been struck by people living in a community near a pantry, but because of their disability or that they're raising their grandchildren and that type of thing, they can't get to the food. So we're really moving forward to get them set up with the resources. We're also using this mobile intervention to work toward the same initiatives through our backpacks. So in reference to the seniors, right away, we had 2,000 seniors that we had not partnered with previously at the beginning of the pandemic to show up and need our assistance. So as the congregate meal sites were not available and that there were challenges with Meals on Wheels distributions, you'll see that we had a period of time, about a month, that we were even. And some of that was due to the reestablishment of services. And then we spiked right back up in the middle of May through June to offer 33,000 additional meals that were more of that grab and go type. Some of those partnerships were not established with us previously, but we did what needed to be done to support those seniors. Emergency backpacks. While we have established backpack programming and that the school systems have done a wonderful job, we have found that so many kids were not able to access all those great available meals. So we ended up with just over 25,000 additional backpacks throughout the course of the bulk of the pandemic while school was out of session. We've started a new school year, and clearly we're all thinking very hard about how we can partner effectively with the kids that are on school sites, and we have some incredible partners to do that. So in closing, I just would appeal to you, think about ways that you can help at your community, at your local pantry, at the food bank. What ideas and partnerships do you all recommend? What can we do to ensure that everyone has the right information? We have found so many that we're not aware of available services. And then how can we all work together to change the usual manner of providing emergency food? So check us out, reach out, facinghunger.org, or feel free to email me and I can share data with you. So I'm gonna hand off to one of my favorite people, Chad Morrison.
Thank you so much, Cyndi. Next up is Chad Morrison. He's the Executive Director of Mountaineer Food Bank located in Gassaway. He began working at Mountaineer Food Bank in 2008 in product sourcing and quickly moved into development in 2010. He helped launch the mobile food pantry program in West Virginia, hosting 33 food distribution and feeding over 8,000 families in just 3 months. He graduated from West Virginia University in 2004 with a bachelor's in sociology and anthropology. After taking a few years off, he returned to WVU and graduated with a master's in applied social research. He is a graduate of the 2018 Leadership West Virginia class and serves on the Board of Community Cares of West Virginia. He is also a member of the National Feeding America Policy Engagement and Advocacy Committee. Thank you for joining us today, Chad.
Yeah, thank you. Thank you for having me today, and what great company I have to share this conversation about hunger and health in West Virginia. So briefly, I'll just give you a short snap of Mountaineer Food Bank and our organization. We, along with Facing Hunger Food Bank, are the 2 Feeding America food banks in West Virginia. We cover 48 of the 55 counties in the state, with a main location in Gassaway, West Virginia, and some subsidiary locations in Weston. We have about 450 member agencies, and I'll talk about those briefly here in a few moments, that we provide food to, and about 150 program sites that we serve every year. We've seen quite an increase over the last 2 years, and we'll talk more about that. First, I want to talk a little bit about some of the data. I know we've touched on this a little bit, but I wanted to make sure everybody had some great resources. We lean a lot on Feeding America. We are a Feeding America food bank, and Feeding America is a national organization, a coalition of food banks across the country. And they have a research team that's able to provide us with a lot of data, a lot of analytics whenever it comes to doing the deep dive into the numbers. So if you look, West Virginia, pre-COVID had about 250,000 people that were struggling with hunger, about 13.9%, slightly above the national average. Of those, over 73,000 are children, again, above the national average. And you think about that, that's, 1 in 5 children that are in households and struggling with hunger. And these are the reported data. I always, as a lifelong West Virginian, I always look at the data through the lens of, this is what's reported, this is what we can work with. But I know that the numbers, there's more people, there's more hungry people out there. So we always take that into consideration whenever we're looking at the data, that there are underrepresented populations out there that are really struggling. So the main clusters, obviously we think of Southern West Virginia, and then you look at Central West Virginia, and you look at the resources, you look at the jobs and the economic outlook of those areas. Both those areas have serious underemployment. They have a lack of transportation. They have lack of public transportation specifically. So those clusters are generally easily identified, but you also look at the food access in those clusters and the lack of grocery stores, lack of access to healthy, nutritious foods. It seems to be, those two areas, Central West Virginia, Southern West Virginia, are predominantly areas where people are lacking in all resources, from internet to utilities to running water. So we see a lot of our food and our resources going to those areas for those very reasons. SNAP usage is very prevalent in West Virginia. Over 16% of homes are receiving some form of assistance. Many of those are homes with children. So we definitely support folks being able to utilize SNAP in West Virginia, because the reality is, as we talk about, and as Cyndi had talked about what food banks can do, SNAP provides 10 times the amount of food and the resources that the food banks across the country can. So those are critical resources in West Virginia for food insecure populations. Okay. So I want to talk a little bit about the structure of the Hunger Relief Network, not just in West Virginia, but across the country. And I think it's important that we define some of the terms and everybody kind of understands some of the processes that happen. So, a food bank, as I mentioned earlier, there's about 200 Feeding America food banks and probably another 100 to 125 non-affiliated food banks across the country. So what a food bank is a nonprofit that stores millions of pounds. And I think, we think of millions of pounds and folks really don't have that viewpoint. But I think it's really important that everybody understands that between Mountaineer and Facing Hunger will probably distribute close to 35 to 40 million pounds of food in 2020. So a food bank safely stores millions of pounds of food that will then be delivered to local food programs like a food pantry or a soup kitchen or a shelter or backpack programs or any type of feeding program that provides food in your local community. What is a food pantry? That's just what it is. A food pantry is a feeding program where hungry families can receive food. Many of them are supplied with food from the food bank or from local donors, but pantries feed hundreds of people per week, some more, but some as small as 10 to 12 people a week. There's food pantries in West Virginia that may just serve a small community, but there are food pantries that may serve, thousands of folks every month. And if you look at the diagram, this is kind of the flow of how a lot of these foods come into either into West Virginia or into the food banks. But we work with everybody, and I mean everybody, to bring food into the state and from the state to get to hungry people. We work with many farmers, many local growers throughout the state, with the West Virginia Department of Agriculture, from all of your major retailers that are a part of the network, to local individuals that do food drives, or local manufacturers and processors that just want to contribute to the cause. So the food banks generally aggregate this product. Sometimes we have our local food pantries or feeding programs pick up on our behalf, but we aggregate most of this product at the food bank locations, and then we deliver that product out into the community. From out near Food Bank, we deliver to all 48 of our counties at least once a month. For the more populated areas, we deliver 2 to 3, sometimes weekly, to those counties. And we'll deliver to the food pantry so that they can pick up, and then they go out into their local communities and provide that food to the folks that are really struggling. Okay. So I wanted to put this graphic up there because I think it's really important for folks to understand some of the costs that are associated with food insecurity, and then kind of look at what what we're investing in food insecurity on an annual basis. So if you're looking at adults, and this is specifically adults, right now we're in that 13% of the population that is food insecure adults. According to a healthcare study provided in conjunction with Feeding America, the annual costs for that are over $327 million on an annual basis. So if you look at this versus if we reduce that number, by 2%, we are reducing that by over $50 million for the costs associated with healthcare that are tied to food insecurity. That's, to me, is an amazing statistic just right off the bat, and really ties into the fact that, hunger and food insecurity is a public health crisis throughout the country for us. So in retrospect, if we look at what's being invested in food insecurity and hunger relief networks from the federal standpoint, on an average year, which I'm saying that because we're in the COVID, the COVID life right now, but pre-COVID, we're receiving, from the federal government between $1.5 and $2 million annually into the food banks. That's administrative funding. And then you tie it into the food costs, and the food costs were probably between 10 or $5 and $7 million annually. Of course, COVID has changed a lot of that. But if you look at the funding that's invested, we're a far cry away from where we would need to be to make the dent that we're trying to make in food insecurity. Okay. So I want to talk about some of the programs that we operate. And this has been, like facing hunger, this has probably been one of the biggest shifts in food banking over the last 4 or 5 years. We look at the types of food that food banks distribute. Historically, the foods that came into food banks were things that were salvaged from retailers or manufacturers. They were products that were near outdated. They were products that were overproduced. So, historically, food banks did not have the best reputation for having ideal foods to distribute to people. And nearly none of those foods were what you would consider a healthy option. Produce, proteins, fruits and vegetables, dairy items, those were things that were really sparse at a food bank and in turn, very sparse at your local food pantry. That's changed. The last 5 years, there's been a monumental shift in what food banks are trying to distribute, they're targeting for their donations, and what the federal commodity programs are even distributing to food banks. And that's really important because, that's changed the way we operate in many ways, and that's changed the way many of your local food pantries operate. Now, we're seeing a tremendous amount of fresh foods, fresh fruits, fresh vegetables, fluid milk, frozen proteins, just an unbelievable amount of those foods, which is awesome, to say the least, for what we're trying to do. So within our programs, like Facing Hunger, our mobile pantry has been one of the core programs that we've operated over the last 7 or 8 years. We are currently doing about 8 mobile distributions every single week in one of the 48 counties that we serve, serving almost 8,000 households every month through that program. And it really focuses on fresh. We really focus on having, 2 to 3 fresh fruits or vegetables, a dairy item, frozen proteins, and then meal items on top of that, trying to make it as holistic as possible. They have grown to where we would distribute from a 10,000-pound box truck to the tractor trailers that you see going up and down the interstate frequently, carrying anywhere from 30 to 40,000 pounds of food. It has been tremendous in the growth of mobile pantries. And no more important than right now during our COVID relief. I think it's really increased over the last 5 months because, whenever we first started talking about COVID and started to draft, our plans around that, one of the biggest concerns we had was exposure, safety of our volunteers, safety of our clients, and our ability to provide food to our member agencies if they were going to be able to be open or not be able to be open. So mobile pantries have really, I want to say, kind of saved the day in many aspects for us, because it is something that we can do safely. It's something that we can do with little to no touch between volunteers and clients, and we can spread people out and make something that's safe for the entire community. Another program that has grown significantly over the last 2 years is our Kids Market program. Our Fresh Initiative Kids Market program started with a partnership with West Virginia University Extension, and it's kind of blossomed into really something of its own for the food bank. Our Kids Market program provides and partners with local growers. For example, we partner with the Turn Row Collective on many of our produce kids markets, and we provide those to elementary age kids so that they have access to that produce. They'll receive between 8 and 10 pounds of produce that they get to select themselves. They'll learn about the produce and how it was grown, how they can utilize it, and the health benefits of it. And that's been a great collaborative with WVU Extension over the past 2 years. Of course, right now, we're struggling a little bit to implement that as we go into the school year, but we're dedicated to continuing that program, because in our viewpoint, that is just another step towards educating children about the health benefits of eating healthy, about the utilization and the partnerships between the food bank and their community. And it goes back to what we talked about earlier today about that stigma of accepting help. I think it's really important that at this age, children understand that they can accept help, that it's not something that should be stigmatized, and that there is this product out there and people out there to help them, or just to nurture, what they're learning about food in their community. The pharmacy models, I'm sure a lot of folks have heard about the pharmacy models. We have partnered with several health clinics, and in the future, I see that as a great opportunity for food banks to partner in their local community. So what we have done in several instances is partner with local health clinics that are doing a pharmacy model where they're having local growers come in and provide fresh produce, writing prescriptions for the produce as a solution towards a chronic disease. We have partnered with them to provide food boxes that can be integrated in with the fresh produce or the fruits and vegetables. So this has been something that we have worked on for the past 2 or 3 years, and we're really excited about 2021 and what that holds, because we've been able to create some great partnerships throughout the state and have some really great potential partnerships that we're looking to unfold that really, tie produce, tie the shelf stable items together and really meet those needs in our communities. Summer feeding, that has been incredible this year. The past 2 years, we've served between 4,000 and 5,000 meals through our summer feeding program. This year, we served over 18,000 meals through our summer feeding program. We actually had to establish a full-time position to manage our summer feeding and our kids market programs. And that's a growing program for us. It's well implemented throughout the state through the Department of Child Nutrition. And it's been very successful with our organization. And we've tried to provide those foods through the food bank so that all of our member agencies, many of which do a summer feeding program, have access to the shelf-stable versions of the meals and also additional fruits and vegetables and dairy for their program. So Meals on the Move, that is also a relatively new program. That is tied into low-income housing, both for seniors and all families. So those are deliveries that we make to housing sites of food boxes that include both the shelf-stable and the fresh products. So we're currently at 18 sites in our service area, and it's growing. It's been growing, and that program just took off in April. So we're up to 18 sites that we deliver at least once every 2 weeks to those sites, and try and provide as much fresh food as possible, along with proteins and the shelf-stable food items. Veterans Table, the Veterans Table program, we serve about 1,500 veterans every single month with a food box. This was established as a partnership between the Veterans Affairs Department. So we are currently working with the Beckley VA, the Martinsburg VA, and the Clarksburg VA to hold mobile drops and also provide Veterans Table food boxes to those sites for distribution to veterans that are struggling. We also have additional sites, I believe, in Morgantown area and also in the Charlestown area over in the Panhandle. And we have branched those out and hope to continue growing that program to all of our counties, so that a local VFW or a local veterans group can host this program to make sure that we're reaching veterans that might not be able to travel to their local VA. The CSFP program, Cyndi touched on that very well. That's been an incredible program for us in West Virginia, serving over 5,700 seniors every single month with a very well put together food box. It's been really instrumental in our programming towards seniors. And also Hunger-Free West Virginia. I definitely wanted to talk on that just a bit because that's something that we, the two food banks and our partner organizations have tried to grow over the last 2 years, and we're continuing to grow that program. It's increased our abilities to collaborate as hunger relief organizations. And, you know, it's got an exciting future. We're currently working on a project for a joint warehouse facility between Mountaineer Food Bank and Facing Hunger Food Bank. And I don't think that that kind of thing would have happened without the creation of Hunger Free West Virginia and the thoughts that kind of went behind that. So it's really incredible what it's led to and the collaboration that's happening between, you know, food banks, our partners, and our feeding organizations in the state. Okay. Well, for any more information, I definitely recommend folks to visit our new website. It's completely revamped at mountaineerfoodbank.org. We also have a wonderful tab on there for individuals to find food. If you're looking for your local food pantry or your local feeding program, that's a great place to learn about those organizations in your local community. It's a great place to find out, you know, how you can engage. And I think that, you know, we need everybody in West Virginia to engage in some manner, whether that's volunteering your time, advocating for hunger relief activities in the state, or just donating to the food banks or to your local feeding program. Everybody can get involved in some way, whether it's just sharing the message if they don't have the ability to volunteer. But, you know, that's the core part of what food banks are in West Virginia. And we need that, you know, that consistent collaboration with the public to make sure that we're serving our state.
Thank you so much, Chad. That was a lot of really important information. We appreciate you presenting with us today. Our last panelist is Margaret O'Neill, Executive Director and Chief Program Officer with United Way of Central West Virginia. After 10 years in healthcare, Margaret began working at WJLS Radio in Beckley. There, she was introduced to Hospice of Southern West Virginia and began her work in the nonprofit community. During her time with Hospice, she helped raise nearly $3 million to build the Bowers Hospice House. The transition from Hospice to United Way of Southern West Virginia came in 2008, allowing her the opportunity to build an established United Way into an even stronger and more impactful organization. In August of 2017, she accepted the position of President of United Way of Central West Virginia and moved her family to Charleston. Again, thanks again for being with us here today, Margaret.
Good morning, and thanks, Kelly, for the invite. What a great hour we've spent so far, and certainly you've heard from experts in this field far better than me. I often tell people every organization needs a token dumb blonde, and today I might be yours for this panel, but great information that everybody has shared so far. I'm just going to talk a little bit about resources and the connection from these two great organizations that Chad and Cyndi run, as well as the food pantries they distribute to, and then how people can access food insecurity needs and resources in the easiest way we think possible. And then also how we as United Ways, and what I'm going to talk about mostly West Virginia 211, about how we use that data and information to make sure people and children especially are fed, and seniors across West Virginia. So Cyndi, you can go ahead, or sorry, Kelly, go ahead and put up that first slide if you want to. When COVID hit in March, and we like to say, you know, about March the 10th is when we started to see some of those federal disaster proclamations happen. And West Virginia 211 at that point had been governed by the United Way Collaborative of West Virginia, United Ways, for about a year. We took over governance in early, 18-ish. And so we had not been long in the governance of West Virginia 211. And for those of you who may not know, 211 is our state and every state in our country's information and referral number. So people can reach out from their cell phone, landline, any phone that they have access to, dial 211 and receive a personal live resource person, an operator, that can help them through whatever the struggles that they may be having. So we had just kind of settled 211 governance. We were growing the services and opportunities. So we had just added a text feature. People can text those same requests by texting 898-211, and in the body of your text, you would put your zip code. And so that allows our operators to direct you to the resources closest to you. If it's a food pantry, if it's utility assistance, housing assistance, daycares, whatever the question, because you input your zip code for us, we're able to make sure that you're directed to the right part of West Virginia and the services closest to you. So we added the text feature. We also wanted to make sure that students, college and high school and younger that are texting had that access. Some kids prefer to text than to call or to reach out. And it sometimes feels safer and less vulnerable for children to do it that way. And then we also have a website, so wv211.org, and people can look at resources by county on that website, but there's also a chat feature. So what we have heard and learned in the last year or so is that for case managers, social workers, school counselors, and physicians or PAs that are in doctors' offices that are working with patients, children, clients, that they can go to that website and very confidentially, without making it a big deal to the person they're serving, they can actually type their question into that chat feature, and our operators will then answer their questions as well, zip code driven and relevant. And it can be a really just a non-ugly or non-stigmatizing way for people to reach out for resources and then give them to the person that they're looking for. So you can see, we thought we really wanted to document this amount of calls and the increase that we anticipated when COVID hit, but you can see we took a pretty significant increase. And so in those first, not quite 4 months, from March the 10th to July the 1st, received over 8,500 calls. And a pretty significant increase of about 400% year over year. And so that gave us a twofold thing. We were super excited that 211 was there and active and useful and helpful to people who had a need. And then we, as governing body of that organization, knew we had to step up and make sure that our operators were well supplied, well trained. Maybe we needed more operators. We were very fortunate that we partner with AmeriCorps members across West Virginia to help serve as operators in their service year. We meet and train with them weekly. And so we stood up, everybody we could to make sure that every office in West Virginia had 211 operators trained and ready and prepared 365 days a year, 24 hours a day, 7 days a week to answer calls, chats, and texts to make sure the citizens of West Virginia were served. So we were super happy to do that. And the next thing that happened is we were very questioning about what those calls were about. And so in any given day, those top needs are very similar to what you just see there. Utility assistance, always a question: how can I get help with my power bill, my water bill, etc. And food insecurity that we talk about today has also been something that 211 gets referenced to a lot, and we're very happy about that. We have a lot of food resources, and we encourage people to call. And then rent and mortgage assistance, which we knew would happen. But as you can see, and you'll see the difference in just a second, but you can tell that that wasn't quite on everybody's mind as much as, do I need to pay my power bill? How do I need to keep the water on? But that food insecurity raised its head big time when COVID first hit. And then we just started to see that inkling in number 4 of shelter requests and homelessness issues or questions that came to bear on 211. So when we get, so I'm going to reference my United Way because I'm here and it's the most fresh for me, but this happens across all 14 United Ways in West Virginia, that we're able to access that 211 data and then provide food assistance in those specific areas that have the most calls. So for example, we can pull here in Charleston, west side specific zip codes, east side specific zip codes, or what we know, Chad knows for sure, and Cyndi, that the eastern part of Kanawha County also struggles. East Bank towards Montgomery, really has some food insecurity. And so what happened is when we started to pull that data, we realized we needed to be, as United Way's, more proactive in feeding. So also with help, Cyndi from the Palatine Foundation, we're so thankful for their support. We were able to receive some money specific to feeding. And then we focus on the last week of the month. And so we know that that's where families struggle. If they are receiving SNAP benefits, as several have mentioned, that's run low. We know that grandparents or great-grandparents that are raising their grandchildren have often been on a budget, and by the end of the month, that budget is wearing thin. And so those feedings on that last week of the month have been pretty important. We have a staff person here at the United Way, Carrie Cooper is our Community Impact Director, and Carrie and her team partnered with the Salvation Army. Salvation Army often receives their food from Mountaineer Food Bank. So I say all that for you guys that are listening to see how we all tie together and how we all work together and know each other to provide the best services we can for our people in West Virginia. So we partner with Salvation Army on the ground, who works with Mountaineer Food Bank, and we take truckloads of food to different areas based on that 211 data. Carrie and her team the last week of August fed over 3,000 people in 5 counties of central West Virginia. So 211 is valuable to us, and it really has helped us with funders to see where they can be most resourceful, how they can put their money in the right places to serve the most people. And so Cyndi, I don't know why I keep calling you Cyndi, Kelly, because I'm looking at Cyndi Kirk's name on my screen. The next thing we wanted to do is to really document what happened if unemployment insurance started to go away, if we started to see utility companies issuing disconnects, and if eviction notices really started to happen the way we suspected. We heard from nationally that we heard July 1st was going to be called, National Eviction Day, and that a lot of the landlords who'd held off on those things chose that day to say we're far enough along into COVID that we want to go ahead and start asking people to consider moving out or having to vacate their rental property. And so we wanted to kind of document that July to mid-September range and see if we again saw a significant increase. And what we didn't anticipate, in all honesty, is that we were going to see an even greater increase in that about 6 weeks period of time from year over year. So about a 916% increase in calls and many, many visits to our website. So again, really happy that it's working, but the ways that we can utilize those resources to make sure that it works the best way we can is we let those utility assistance folks know that 211 can help them. So most recently here in Charleston, a local utility provider called ahead of time and said, we're sending out about 2,700 disconnect notices that totaled about $700,000 in bills. And in the letter to their customers, they referenced, if you need assistance, call 211. So we were able to be prepared for an onslaught of additional calls, and we were able to work pre-calls to make sure that all the partners in our community that had funding for utility assistance, that we were on top of it, that our 211 operators knew who had extra money related to COVID, who had money related to COVID relief from different foundations and partners that we have, so that as those folks call, we kind of keep them from that runaround. The frustration people have when they call for services is often that I call one place and they, tell me to call somewhere else, and then that number's disconnected, et cetera, et cetera. So one of the things that is really important to us as 211 folks, and that was really important not only at the beginning of COVID, but still where we are today, is that those resources were current and up to date. So again, our thanks to Chad and Cyndi and others that we were able to touch base with them, our other food pantries, our other providers, and make sure that our data is current and accurate and up to date. Early on, we had to do that sometimes 3 times a week. You heard reference from somebody, a lot of our volunteers at food pantries are elderly people. It's their volunteer opportunity after retirement. And we were saying to them, stay home, don't come outside. We want you to be safe. And so a lot of food pantries lost volunteer opportunities and really struggled in those early weeks and months of COVID to stay open. So we were changing our data frequently to make sure that we were referring people accurately into food pantries that were viable and open. And so you saw what happened July. Utility assistance just really took a jump. And what you can't see, I don't know, maybe you can, that's about 2,000-ish people that were calling for assistance. And then on the food assistance, my line's a little bit longer than that. And again, it was just under 2,000 calls. So all of that said, 211 has been a great connector to resources. And one of them is Handle with Care. So about, I don't know, a couple of months into COVID, I had a conversation with my friend, and I know many of yours, Andrea Dar from Handle with Care. And we started to talk about her concern and others about how we made sure kids knew that they had a resource if they were picking up food at feeding sites and those kinds of opportunities. So Handle with Care partnered with United Ways across West Virginia, and we made yard signs that have a lot of the same information that you would see on here. And it's call 211, text 211, visit the website, and that children even could do that. So teenagers, young people, people that may not have any idea about how to reach out for assistance or never had to do that before, would be able to see those yard signs near their feeding sites, near their schools, near their community centers, and say, oh gosh, I didn't realize I could call or text or visit that website for assistance. So our huge thanks to Handle with Care for that additional funding that allowed us to get those signs, and still today to get those signs out across West Virginia. And if you need one, all you have to do is call me and I'll bring it to you. I will also tell you that we were reached out to by the state of West Virginia to help them provide a feeding map across our state. And so this was really right before school was out, and it was focused on summer feeding for students. And so that map was put together and is also on our website at wv211.org, another way to access feeding pantries and as well as senior feeding sites. And we're in the process of updating that now. Actually, the state is with what children feeding sites are going to be available. And I'm sure you guys know that school is still kind of up in the air. And I'm going long, but I just want to mention two quick things. My heartfelt thanks to Chad Morrison and Mountaineer Food Bank, because we experienced here at the United Way of Central West Virginia what a true food desert looks like. And I was doing some reading lately in the term food desert. This gentleman described as not a great way to do it, because deserts are natural. And what we see happening in counties, not only across West Virginia, but other counties and states that Dr. Amjad mentioned that experience high poverty, is that grocery stores are just closing up and leaving. And there's a lot of reasons for that. Cost is expensive if they're only delivering to one or two grocery stores in that county potentially. And some of our rural counties are just frankly hard to get to. And so we found that in Clay County, West Virginia, in early 18, and they lost their last supermarket. They have a population of just over 8,000 people. Many of them live in poverty, and many of them are seniors. And we were seeing them have to drive an hour and a half one way, an hour and a half to a grocery store in cars that often weren't necessarily able to go that far, and many of them without transportation at all. So Mountaineer Food Bank and the United Way have been distributing food in Clay County now for about a year and a half. And here's how you can help with the stigma. So when we take volunteers to help with those food distributions, sometimes there are people who have never, and what I would say here in my office is that they've never been hungry. And so sometimes that stigma and judgment comes just because you've never experienced it yourself, and you think, oh gosh, they should be able to work, or they should be able to do this, or I don't understand why they can't buy food for their kids. And then you go to a food distribution, and there are two sisters who come through that line faithfully. Both have suffered from cancer. One's on oxygen. They have one car. They share their food boxes, and they are so appreciative when they come through and see that the consistency of what Mountaineer Food Bank has been able to provide in that county has been exorbitant. And so the marriage between all of these providers sometimes comes directly through your boots on the ground in those counties. So a lot of times it's our United Ways. But what we would say to you all is West Virginia 211 is your connector. I tell people every day it's your resource of resources. If we don't know what the resource is, that identifies an unmet need for us. And so we're not just collecting data to say, here's all the stuff we did do. We're collecting data to say, here's all the stuff we need to do. And I'll give you one last example and I'll shut up. But that example right now is internet connectivity. And so as we have people calling 211 across the state, our operators, typically when they say, I need utility assistance, that would never include cable, right? It would never have included my Suddenlink bill, because we, and you can judge it or not, but we would typically not pay a Suddenlink bill versus somebody needing food or power or water. But this is different. And so when we started to get calls from families who said, you know, I got kids, I'm supposed to do virtual, I don't have internet, I can't pay my bill, how can you help me? It made us take a step back and say, how can we help them? And is there a way that through 211 we can start to gather data to really share with state folks and some of those policy people that we love to talk to and advocate on behalf of people, and certainly children in West Virginia, but that we have to find a way to connect these kids. And so it all matters. It matters if they're going to be hungry in 10 years from now if we can't get them educated today. So, you know, we fight that every day, but 211 is there to serve and help. And we have this size card, little rat card, and we have this little size business card. And if you need any of those, anybody that's on the summit in the next weeks, just please reach out to us, and they're free to you. We will get them to you. You can have yard signs and you can distribute them any way that you can. But my great privilege to be part of this today, and happy to answer any questions.
Thank you, Margaret. Thank you to all of our panelists. And what I'm going to do now is I'm going to stop sharing my desktop and open up the chat and the Q&A and see if we have any questions. Let's see. We see a great job, Cyndi. And Margaret O'Neill is a rock star. Well, two things that we knew already. And let's see. Here's a question from Sharon Maynard. Chad and Cyndi, excellent overview and excellent work. Do you find that there are still unmet needs in terms of food availability or food type?
Who wants to go first?
Okay. Hi, Sharon. Sure. As we referenced, I think we would really love to have more fresh food and really provide it in a way that would be safe for the children with volume. Again, as I referenced, I think we've got kids that certainly what they're eating now is a lot better than what they've eaten before, but we can always do more and better. And I think that this pandemic has certainly forced that ball forward for us to find ways. I'm so grateful for the Department of Ag to remove that congregate feeding requirement for a lot of the summer feeding programs and the congregate feeding programs, because both Chad and I can cite many examples of kids who would come and get a meal, but because of the congregate feeding requirement would leave without food for their siblings at home. So of course we're sending food home, but when you're reimbursement based, you're not going to get paid for those meals. So I think that if we just continue these conversations, using all the expertise around the state to really come together and figure out better ways, and shift the thinking from the traditional to what we're doing now, a lot of new ways of distributing food. So that's why, really appealing to all of you, what can we do to make sure that kids have ready access, and that the conversation goes beyond this pandemic? Because when we had kids out for the teacher walkout, everyone was very concerned about feeding kids. Well, we're feeding them every day. So this is not new to us, but, then we also have people going, well, why are you giving them canned items? Well, because that's the better option right now versus nothing. So, clean protein options, I'd really love to explore more of those, and making sure that the kids understand and learn about those products versus, they won't eat it because it says, something that they're not familiar with. We, at one point, purchased vegetable and fruit juice. And if we gave it to them in the container, they didn't want it because of the vegetable. So when I did a side-by-side without the box, they loved it. So, that takes time, but it's worth the investment.
And if I might add, kind of to build on what Cyndi said, I think, if you look at the consistency of having access to those foods, and that's been the biggest struggle in the nonprofit world. As I mentioned earlier, historically, food banks and food pantries did not have access to healthier options. And it's kind of like a roller coaster. Nonprofits are impacted by everything that goes on in the world, from your geopolitics to your local politics to local industries, to the local consumer movements. So we ride that roller coaster and try to build programs and foundations for access, and sometimes that's a real challenge. Right now, with some federal funding and federal food that's coming in, we have tremendous access to healthier options. How long that's going to be, we don't have any assurances. I think we know until the end of this year what that's going to look like at the federal level through commodities. So we have to plan and look at, other options through donors, through purchasing of our own accord, and try to build some stabilization. So consistent access to the right kind of foods is always on our mind. Where can we find partners that are in it for the long haul? Not just a 3-month commitment or a 6-month commitment, but this is what we're trying to build in West Virginia. So we're always looking for that. And we're taking advantage of every opportunity we have for the short-term solutions while we can as well.
And all I would say is we love that they're doing that. And then the United Ways are trying to figure out how we can help people not be hungry, right? So while they're feeding them, then we're trying to figure out what does it take to build capacity for that family to be able to feed themselves? Is that a different kind of work opportunity? Is that a different living experience? But what is that? Because sustainability for these folks, I say this a lot, none of us all together are ever going to have enough money to keep doing this forever. We've got to figure out ways for people to be able to feed their own children.
That's a wonderful point. Thank you, Margaret. I believe that both Sharon and Judy Crabtree had their questions answered. Is there anyone else on the webinar who has a question they'd like to ask? Make sure we don't miss anyone. Okay, we are almost right at time, which rarely happens. So I'd like to thank all of our presenters so much for your time and your expertise in joining us today. Next steps are thanking our sponsor, Unicare, thanking our panelists, thank our attendees. Thank you so much for being here today. We hope to see you on social media to keep this conversation going. I hope you'll join us next Tuesday, where we discuss health and hunger from a provider's perspective. You mentioned Clay County, and we will have Dr. Becker from Clay County, who will be talking about, living in a food desert and trying to connect families to needed resources. And so we're really looking forward to next week's conversation. That's Tuesday at 10. You'll see a recap of this conversation on our blog on Friday. I'm hoping to see more folks raise questions and join in the conversation. And we'll have a report at the end of all of these sessions that will include the challenges and potential recommendations that we look forward to sharing with policymakers around the state. So with that, I want to wish everyone a great day and see you next week. Bye-bye.
Thank you.
Thank you.